questions, they're listening via YouTube, so there's about 15-second delay.
Okay.
So they'll- that
Okay.
makes sense.
So we're ready. Just give me a thumbs up when you have sound.
Yes, sir. All right. So,
Good morning, and thank you for joining us today. I want to make a few introductions as it relates to the guests that we have with us. We have, to my left, Council President Paige Beebe. Council President Beebe will review our state of emergency declaration and discuss how residents can reach their council representatives. Off camera right now, who will take my seat and where my hands were just washed and all that good stuff, is Decatur Morgan Hospital Representative Anita Walden, Chief Nursing Officer, and Anita will give us the latest update from our medical staff on the front lines of COVID-19 treatment. Then to my right, my friend, Bridge Builders International Pastor Darius Creighton, and Pastor Creighton will speak about how our faith-based communities have been impacted by current social distancing measures. Behind me, we have Sign Language Representative Kelly Howbrooks. And Kelly, thank you for coming to assist us with the press conference today. Just a few updates. Current Morgan County COVID-19 cases, we have 20. And so with that, we just want to remember that we're on a marathon, not a sprint pace. We have a long ways to go. Again, our residents they're doing a wonderful job following the guidelines, but we cannot become complacent. And this is that time maybe where we would want to relax just a little bit, but now more than ever, social distancing, washing your hands for the weeks to come. Please continue with that. A reminder that our trails and park pathways are still open. Remember to keep a distance of 6 feet between one another. Remember that hand signal with the smile that we've talked about if you see someone gathering together. And then no more of 10 people should be at any location. City Hall, remember that we're open, but it's by appointment only, with the exception of the police department. If you need to make an appointment, please visit DecaturAlabamaUSA.com. Go to our department sections, and there you'll find the department that you may want to do business with, where there's contact information, and they will help you with your needs. Our police and fire are continuing to respond to calls and emergencies as normal. If you feel that you have a COVID-19 symptoms and need to call 911, please make sure to tell the dispatchers so that our first responders can take appropriate safety precautions. Garbage will continue to operate as normal. Remember that our recycling is closed at this time. Then the federal government continues to release more information daily as it relates to federal relief assistance. Last Monday, our guest was Chamber of Commerce President and CEO John Seymour, and Mr. Seymour talked about some of the helpful links that you will find on their website, or you can contact your local bank to determine if they are qualified, because many of our lending institutions are assisting with the federal government with issuing loans and grants. So with that, I'm going to turn this over to our guest speaker, with Council President Beebe being first, and yield my seat to Ms. Walden, and a reminder that our next press conference will be Friday, April the 3rd at 10 o'clock. Thank you.
Thank you, Mayor. I think the Mayor and Chief Allen would like for me to address, we've had some questions from the residents of the city about how the state of emergency declaration for the city works. I'll give you a brief timeline. On February 28th of this year, our police chief, Nate Allen, decided we needed to have a task force to address this virus that seemed to be coming towards the United States. The 28th was their first meeting. The 1st of March, they had their second meeting, which was a working meeting, where they actually made a plan and had things put in place for when it got to Decatur. On March 13th, the governor of the state declared a state of emergency, a public health emergency proclamation for the state of Alabama. That same day, President Trump also proclaimed a national emergency. On the 16th of March, after speaking with Mr. Eddie Hicks, who is our EMA director, and Chief Allen, the council decided that was time for us to then enact the city State of Emergency Act, and we did that, Resolution 20-89, and that was a unanimous vote to do that. And with that, people ask then, what does that actually mean? That actually means we have a City of Decatur incident management plan. This plan we as a city talked about several years ago when we had our storm and the wind damage several years ago. We had our meeting afterward, and we really nailed down this plan for all the councilmen and all the directors and the mayor, how that would disseminate from one to the next. When you enact this plan, you go to the back here and it has a line of succession. And there is an incident manager, and that is Chief Allen. At that point, I know there was some social media post on, well, the council can tell him to do that. Well, actually, no. When we declare a state of emergency, that gives Chief Allen that right to do all things. Now, he does consult with us. That's where communication is key, and Chief Allen is a wonderful communicator, and he does get our input. But he is also the chief of police and knows how instances like this need to be appropriately handled, especially with viruses and contact and things like that. So this, and if you'd like a copy of this, we can certainly get that to you. There is also a FEMA government one that we have very similarly taken examples from. So those are what we go through. And March 27th, our A&E district was suspended by Chief Allen. We've had some questions on social media that I've seen about that. And I'll just tell you a lot of why did that happen. One bad apple can spoil it for everyone. So it is unfortunate, but this virus is very well, it's just serious. I'm not sure that some of us realize the seriousness of it. And in fact, I've done a little studying on it. And the influenza is spread 1 to 1. This COVID-19 is spread 1 to 3. So let's just take one person. If I were to infect, it would be 1, 3, 9, 27, 81, 243, 729. So times 8, it would be 2,187 people that I would have exposed, only with 8 different people. That gets rapid. We have a city of 55,000, 56,000. That could be detrimental if that happened and it wasn't maintained with social distancing. So for me, that's very important. And also, this is a very interesting fact that I looked at last night. December 31st, 2019 is when China, which I'm not sure how much stock you can put in, it's the date they gave us, that they started seeing these cases there. And it was 80 days until China then on March 19th reported their last case, 0 cases after that. That's 80 days. So if you look at when the president on the 16th of March declared the national state of emergency, 80 days would be May 1 or 2. And as of yesterday, you see that he has expanded that social distancing, that state of emergency we need to stay ready in for another 30 days, which would take us to that time period. So we have learned from other countries that an 80-day time period you see on the every day when they have their press conferences. Deborah Bricks, I've been very impressed with her, and so happy that we have such an amazing scientist that can help go through and disseminate the charts and then bring them down to a level that someone like I can understand. They are very sobering if you take the time to look at those. And if you look at those and we put in place the social distancing aspect of it, those level off quite quickly. If they don't, you get those extreme numbers that have been put out there. But if you listen to the scientists who are doctors of infectious diseases, these doctors that are on that task force are the best infectious disease doctors you can get. We are very lucky to have them on that task force. And when they advise us to do things, I think it's very important that we do that. I know that everyone says, well, New York is different. There are millions of it. There are millions of people there. But just think, if we were to bring just one person, just as I did those numbers, the people that one person could then infect, and then it would just be a widespread thing for Decatur. It could be very detrimental for Decatur if we do not very wholeheartedly look at those guidelines. And everyone should have got one of these postcards also in the mail from the federal government. And these are the guidelines that the president and the task force are asking us to go by. And we as a municipality are sticking with those, and I think that's very important. Some of those images from other countries are more than sobering. They are heartbreaking. The images we have from New York and Washington are heartbreaking. The love of this city that this council and this mayor and this police chief and our employees have, we do not want to see that in the city of Decatur. I know these times are, you feel like you're in a box. I understand that I'm a goer and I love to go, and that has been put on hold. And yes, I've done a lot of cleaning, let's just say that. So maybe we're getting a lot of cleaning done out in Decatur, but I have 100% faith in Chief Allen and his decisions, and please be assured that he is 100% transparent with us and very vocal, and the communication is not at all hindered one bit. So we are going on his recommendations. So any other questions, I would answer if anyone has any. Okay, or I can do those at the end.
Just to reiterate what Paige just said, this is a very serious virus, and we are taking it, of course, very seriously at the hospital. We do have incident command set up, and that's where I report every day, and we stay there all day. We are making decisions very quickly. We are following our system guidelines, guidelines that we already have in place to take care of issues just like this. And we are, of course, keeping up with our state and national directions as well. Please, please, if you don't have to go out, don't. But we do encourage you also that if you are sick and you need attention, please don't wait until it's too late. We have a lot of residents here in Morgan County, Decatur, that have chronic illnesses, and so please take care of yourself. And again, if you need to call someone, call your physician. If you don't have a physician, you can call the hospital. We want you to get the care that you need, so we don't want you to be afraid to come. Just to give you an update on today's numbers, we have 93 patients in the hospital. We have 99 beds available and open that we could put patients in. We have tested 95 patients so far since this began, and we have back 72 negative results. So most of our testing is negative. We do have 5 positives, and we have 0 inpatients that are positive for COVID-19. 5 are quarantined at home. Our clinic, the Morgan County Fever Clinic, is located in Hartselle. We test patients that have a physician order only at this point. The reason being our tests are very limited, so that's a nationwide issue that we have a limited number of testing kits. And so far we have tested 90 patients out in the community, and of those we've only had 1 positive come back. It has helped us greatly that some commercial labs have opened up, so we are getting our results back just a little bit faster. Just to reiterate from last week, our employees are keeping themselves and our patients free from infection by doing a stringent operation in PPE. Of course, we're doing the regular things that we always do. We wash our hands. That is the number one way that we can keep from spreading disease. We, at this point, have an adequate amount of PPE, but we are being conservative. We continue to have no visitors, and at this point, we are able to speak with our visitors, our patients' families by telephone, and we do what we can to help the patients. If they can FaceTime or video chat, we encourage that. We feel that every patient needs to hear their family's voices and see their face if they can. So smartphones have been wonderful in that respect. We're limited to one entrance at the hospital. So all other doors are locked. When you come in the one entrance, whether that's a staff member, a physician, or a limited visitor, their temperature is taken. Anyone with a temperature that is 100.4 or greater is turned away. You may not come in. If a staff member's temperature is that, then we have a process by which they are handled. They are sent home. We have no self-serve food in the cafeteria. Everything is either served by a cafeteria worker or it's a grab and go. We have team members whose assignments are solely to wipe down every surface. So that's doorknobs, telephones. We encourage the community, please also do that. In this building, I appreciated that the mayor said that he had washed his hands. That's great. I'm still not going to touch anything if I can help it. And I encourage you to do the same thing. That is the way that we can protect ourselves and each other. Communication, again, is key. We are in constant contact with our managers, our directors. We want to hear what the staff's concerns are, questions. I know the community has fears. Well, so do our employees. They're on the front lines, but we are answering their questions as they arise. And sometimes they're answering our questions also. So that's very helpful. We appreciate the outpouring from the community. I can't even begin to tell you how many people have called and offered to feed our group. So we just had a call this morning that want to send boxed lunches. So we're making sure that every department is included. You know, this is not just about physicians and nurses. This is about your lab personnel. This is about your housekeeping personnel. Everybody that does anything at the hospital, we are including. So we appreciate, again, the outpouring of gratitude and thank yous. The little parade last weekend was just amazing. So we do appreciate those gestures, and it means a lot. So we still take mail and cards and all those kinds of things. So keep those coming, please. We have several things in place as far as algorithms that if an employee feels that they've been exposed or we believe they've been exposed, we do have a complete process by which we assess, is it a high risk, is it a low risk, and what do we do from there. So we're taking care of our employees. If there's any question whatsoever, they will be quarantined. Should we reach a capacity? I know that's been a question. We have been very fortunate in North Alabama so far, and we hope it stays that way. However, if that is not the case, we are prepared with a surge plan. So we have many other beds that we can fill, and we have a plan for staffing as well. So we can share that at some point in time, But every day we add to that surge plan because somebody comes up with something different. Every time we watch the news, we're watching very carefully what's going on in New York and what's going on in Louisiana. We don't want to get caught without having adequate plans in place. So thank you very much.
Awesome. Well, first of all, I'd like to thank the mayor for the invitation this morning to be a part of today's session. And I was asked to speak on the impact from the faith-based communities and how they've been impacted by social distancing. One of the things that I would first say is that I think that the church is a vital part of our community. And one of the things that as a pastor and as a part of that community, I believe our responsibility, first of all, is to pray for our leadership across the nation, around the world. Pray for those first responders, people that are in the medical communities, that they will stay safe, but that our leaders would clearly be properly advised, be able to hear from God as to the direction in which we all take, and then everybody abide by those laws, those rules, so that mainly everyone can stay safe. When you think about the church has a responsibility to minister to its parishioners, its congregation, but at the same time try to effectively continue to work the business aspect of church. But at the end of the day, I think we, the church, should be utilizing the power, the authority that's been given unto us, by God through the Holy Spirit, and praying, not just talking about the virus, but let's pray against it. Let's call it out. Let's get it taken care of and pray that it would leave our coast, leave this country, and take that authority and that power and utilize it. We preach it, we talk about it, but now's a great time for us to operate in it. And at the same time, stay safe. From a church perspective, churches are having to come up with creative ways to continue to minister and to try to keep their congregations together. Things like social media, online ministries. And I can tell you it's different preaching to a camera than it is preaching to a congregation full of people. But it is something that we're having to learn to do better. And some churches who may not have had social media or media in their churches may be challenged at this time to try and get all of that in place and continue to effectively minister. But it is a little different. They're being very creative, using Zoom for Bible studies and online presence. We've even seen a few churches do what they call drive-up church, where people drove up in the parking lot and heard the gospel being preached. And so everybody stayed in their cars. They're keeping the 6-foot distancing and just coming up with creative ways to try and keep the Word of God going so that our faith can be more impactful than the fear of what COVID-19 has brought to our nation. And again, that fear, if you're sitting listening to CNN or Fox News all day, every day, you will be very fearful. Now, is it serious? It is. And we all need to pay close attention to what's happening around us. But at the same time, we need to use the power and authority that's been given unto us to speak against this COVID-19 virus and keep all of us safe. And I think safety is the key for everyone. But for churches who may be financially challenged, I understand that on Friday there was a federal government mandate or an opportunity for churches to get some financial support. So if you are a church that's operating and you're finding that you're needing financial support for staffing, utilities, facilities, there's something called the CARE Act that you need to look into, and that's C-A-R-E, the CARE Act. And the federal government is making funds available for churches to keep up and not falter during this time frame. So I think it's a 2.5-month process, or a 2.5-month not a process, but enough finances to cover you for 2.5 months. So look into that, and that could be a benefit and a blessing to you as churches. But more than anything, we just need to stay together in faith, trusting God, trusting in what He has provided for us through Christ. One of those things is healing and deliverance, and we have to believe that right now and continue to pray for those families that have been infected, and pray that they would be healed and delivered. And so if we continue to do that, I think all of us working together within the community, we can see this virus come to an end in a quicker manner. So that's what we're believing God for. That's what I want to see happen, and I believe all of us do as well. So thank you, Mayor.
Thank you, Pastor, and thank you to all of our guests. Pastor, know that the prayers are being felt for, I believe, everyone in this room, or the leaders in this room, and for all of our public servants. So with that, now we'll take a few questions that our media partners might have.
I believe this is going to be Dallas from Channel 19. Dallas, are you there?
I'm here.
Okay, go ahead.
Can I talk now?
Yes.
So this is Dallas Parker of WHNT. I'm wondering, there are people asking, what they can do for medical staff. You kind of mentioned that briefly. What's acceptable and what's not, just to clarify for the general public.
Nita, that would be for you, I believe. Maybe clarify the question, if you would.
Yeah, if you would. So you're saying what kind of donations are acceptable?
Did you hear that, Dallas?
Not really. It's kind of a delay.
Oh, she is saying, what to clarify your question, what kind of, are you asking about donations?
Donations, as far as people sending gifts, you talked about lunch, people trying to make these masks, things of that nature.
Okay, so donations of food, if you will call ahead, then we can direct you where to deliver. And we would like to know, how many of whatever you're going to send can we expect. And we're keeping a running list of departments that have been fed, and we want to make sure that we catch everyone. We had a local florist that had flowers that obviously they would not be able to use, and they wanted to know if we could have those. And so they delivered bouquets for every care unit. So they called ahead, though, and that's the key. Call ahead. Masks. We have had many inquiries about masks. So while we would not use that as a front line for our staff members, as long as we have PPE, that is FDA approved, that's what we use. In severe cases, the Joint Commission, who accredits us, has said in severe conditions, then we could go to homemade masks for staff members to protect themselves. However, let me reiterate, for COVID-19, a surgical mask or a homemade mask is not going to protect you from the disease. That takes an N95 or a respirator. Any other kinds of donations? Of course, dollars is always appreciated as well. So our foundation has been working to get that information out. So if you will check our Facebook page, there should be ways that you can donate.
Yeah. Did you? I'm going to put them on hold.
Okay.
I believe this is Matthew from Decatur Daily. Matthew, are you there?
Yeah, I'm here.
Okay, go ahead with your question.
Decatur Daily, Matthew Speakman. I was wondering if you guys have noticed any kind of trends with your positive cases. Are they coming from a certain part of the county or a certain age group or anything like that?
So the question is the health hospital noticing trends coming from a particular part of our community, our county? Page three.
Not from the hospital, no. I don't know about the county. I know that the numbers are larger in the county than we've seen at the hospital. So, but not from the hospital.
This is Ashley from 31. Ashley, are you there?
Yes.
Go ahead with your question.
Not from the hospital, no.
Sorry.
I don't know.
With I had a clarification question and then like a general question. Is that fine?
Sure.
Okay. So my clarification question, on Monday they said that one person was in the hospital, so I was just wondering if that person had been released and they hadn't tested positive. And then for my general question, they say that they have a surge plan right now if they do need more beds, but do they have a plan if they do start running low on PPE? Is that part of the surge plan?
Okay, so the first part of the question was, if I understood correctly, we did have one patient that was in patient status that was positive for COVID. And yes, that patient did get better and has been able to be discharged home to quarantine. So we are excited about that. For the second part of the question, for the surge plan, as you know, we're a part of the Huntsville Hospital system. And so every day we have an inventory of available PPE. And so far, we have an adequate amount. When we ask, that's what we receive. So we're being very careful to conserve it just in case of a surge. But we certainly have adequate supplies to take care of our patients and our staff members. But that is on the surge plan as well.
Next question.
Dallas, you have another question?
I do indeed.
Go ahead.
All right, this is Dallas again from WHT. I'm wondering, have you all seen any issues with non-essential businesses refusing to close? If that is the case, what has been done or what can be done?
We really haven't, but if our residents know non-essential businesses that are not closing, as been directed by the third supplemental order from Alabama Governor Kay Ivey and the Alabama Department of Public Health, please contact the Decatur Police Department at 256-341-4600. That's 256-341-4600. Thank you. Next question.
Matthew?
You have another question?
Yes, I do. Go ahead.
Yes, go ahead.
Yeah, I was wondering what precautions you guys were taking with the police staff. And I've seen around the country that some police staffs have been affected by the virus. And if you guys do have a member of your police staff test positive, what are the steps you guys are going to take to make sure it doesn't spread throughout the staff?
Matthew, that's a great question. And so what we hope to have, I'm just going to have to defer on giving you a clear answer on that now, because really that needs to come from our police department. And we hope to have a representative of our police department with us Friday. So if we could maybe present that question again Friday, where we are able to provide factual information, I believe that would be better for those that read the paper and those viewing this conference now.
Ashley, you're there?
Yes.
Have another question?
Yes.
Go ahead.
With the park still open, the trails and the pathways, I know on Monday they said police were still enforcing social distancing. Are they telling people to separate? I mean, how can they truly enforce that?
So, great question, and yes, we can enforce that, and we will enforce that. There's different steps along the way that the officers make the enforcements of that nature. Again, I'm not trying to kick the can, but I'm not the better person to give the detailed plan as it relates to answering your question. So if you would be sure someone asks that question again on Friday so that we can get factual information out. But again, if anyone sees that we are not social distancing, please utilize the same number that I provided a while ago. Thank you.
Dallas, you have another question?
I do. We've gotten a lot of complaints or concerns about workers at construction sites. How are jobs like that being managed? I know it's kind of almost impossible to keep a safe distance away from, your coworkers when you're working on building something. So,
well, although that you used the word impossible, it's not impossible. We've been mandated by the guidelines established by Alabama Governor Kay Ivey and the Alabama Department of Health to utilize safe distancing, which is 6 feet. Anything that's not being followed as it relates to those guidelines should be reported to management. That would be the first level, and then from there to the Alabama Department of Public Health. Thank you.
Matthew, you have another question?
No, I'm okay.
Okay, thank you.
Ashley, you have another question?
no, I don't.
Go back to one, or?
Okay, well, thank you so much. Thank you to our guests for attending today.
Thank you, sir.
And for everyone that helped make this possible. And Kelly, for being here. And we will return Friday at 10 o'clock. I believe we're expecting a representative from Decatur Morgan Hospital again for a healthcare update. And hopefully I don't want to put anybody on the spot, but hopefully a representative from the Decatur Police Department. Thank you so much.